Hey everyone, welcome to World Watchers. Today, we're diving into an interesting and important comparison: how the COVID-19 pandemic of 2020 stacks up against the HMPV virus in 2025. Both are viruses, but the way they spread, the symptoms they cause, and the impact they have on our world are completely different. So, if you're curious about these viruses and how they're affecting our world right now, stick around. Don't forget to hit that subscribe button and ring the bell for more updates. We will discuss about what they are. Let's start with the basics. First up, COVID-19, caused by the SARS-CoV-2 virus, made its global debut in 2019 and reached pandemic levels in 2020. It primarily affected the respiratory system and spread rapidly worldwide. In contrast, HMPV, or human metapneumovirus, is a respiratory virus that's been around since the early 2000s but has gained more attention in 2025. While it's not new, it's spreading faster and impacting more people now. It's similar to other respiratory viruses like RSV and the flu but tends to hit younger children and older adults harder. Transmission. Now let's talk about how they spread. COVID-19 is primarily transmitted through respiratory droplets when an infected person coughs, sneezes, or talks. We learned early on that it could spread through the air, making masks and social distancing crucial. HMPV, on the other hand, spreads much like other common cold viruses. It's also passed through droplets but can survive on surfaces for hours, which means touching contaminated surfaces can also lead to infection. While it's not as airborne as COVID-19, it's still highly contagious, especially in crowded environments. Symptoms and severity. When it comes to symptoms, there's a clear distinction. COVID-19 caused a wide range of symptoms: fever, dry cough, loss of taste or smell, and severe breathing difficulties for many, especially with the Delta and Omicron variants. Some people experienced long-term effects, known as long COVID. In contrast, HMPV tends to have more typical cold and flu-like symptoms, like cough, runny nose, fever, and sore throat. However, in more severe cases, especially among the elderly or immunocompromised, it can lead to pneumonia or bronchiolitis, similar to RSV. Global impact. In terms of global impact, COVID-19 took the world by storm in 2020, forcing governments into lockdowns, schools to close, and the healthcare system to be overwhelmed. We saw entire industries disrupted, and economies struggled as the world scrambled to contain it. Insert montage of news clips from the 2020 pandemic. Fast forward to 2025, and HMPV has been a major concern in some regions, but its impact is much more localized compared to COVID-19. It's primarily affecting vulnerable populations like children under 5 and older adults. However, thanks to advanced vaccinations and treatments developed during the COVID-19 era, the overall global response has been much more efficient: vaccines and treatment. One of the major differences is how we're handling vaccines and treatments. In 2020, we had to scramble to develop COVID-19 vaccines, and it was a race against time. By 2021, we had multiple vaccines available, and that helped reduce severe cases and deaths. With HMPV, while there isn't a widespread vaccine like with COVID-19 yet, treatments have improved. Doctors can manage symptoms effectively with antivirals, and most cases resolve without complications. There is a push to develop a vaccine for HMPV, but it's not as urgent since the virus doesn't cause the same level of strain as COVID-19. Current situation in 2025. In 2025, COVID-19 is no longer the major global crisis it was in 2020. Vaccines are widespread, and the world has learned to live with the virus through precautionary measures. Meanwhile, HMPV is being carefully monitored, but the approach is more about treating it as a seasonal respiratory virus rather than a pandemic-level threat. Conclusion. So, what have we learned today? While both COVID-19 and HMPV affect the respiratory system, they differ greatly in their severity, transmission methods, and global impact. COVID-19 reshaped the world, while HMPV, though concerning, is something that is more manageable thanks to the lessons we've learned from past pandemics. Thanks for watching. You can subscribe our channel if you want more videos like this and let us know in the comments what you think is going to happen in 2025.